Welcome to the Food Allergy Nursing Association's August Speaker Series. Today we will be discussing quality improvement basics, designing projects that last. This activity is approved for 1 contact hour of continuing education by the American Association of Nurse Practitioners, and the activity was planned in accordance with AANP accreditation standards and policies. Thank you for joining us today. I encourage you to become a member of the Food Allergy Nursing Association, also known as FANA, if you are not already. Membership includes 9 months access to the continuing education sessions online so that you can get CE credit throughout the year, as well as many other membership perks. Today, we will hear from Lauren Hurley and Emily English on this topic. Please note that due to a glitch, this recording is not the speakers, but it is generated using AI notes from the speaker session. And you can obtain your CE credits by completing the survey after the session is completed. Dr. Lauren Hurley has worked in pediatric nursing since 2006 and became a board-certified pediatric nurse practitioner in 2012. She received her Doctor of Nursing Practice in 2022. Her research and clinical practice focuses primarily on IgE-mediated food allergy treatment, prevention, and management in pediatric and adolescent populations. She is involved in quality improvement initiatives with several primary care practices working to improve guideline adherence for early introduction of allergenic foods in infants to prevent food allergies. We also have Emily English, who is a research instructor at the University of North Carolina at Chapel Hill. She is a study coordinator for the UNC Food Allergy Initiative, which conducts clinical research trials with participants with food allergy. She also provides clinical care as a board-certified pediatric nurse practitioner at the UNC Children's Specialty Clinic as a part of the Division of Allergy and Immunology. We will be covering 3 learning objectives today. The first objective is to describe what quality improvement is and how it differs from research, evidence-based practice, and routine clinical work. We will summarize foundational QI frameworks, including the PDSA, Model for Improvement, and Root Cause Analysis. And we will learn to apply QI to daily practice and identify opportunities to integrate QI thinking into routine patient care. Again, we have our title slide, and just to reiterate, Emily and Lauren will not be speaking through here, but I will be speaking using AI-generated notes from this session due to a technical glitch. So when considering your career path, it's essential to ask yourself key questions. Are you interested in leading clinical research trials? Or do you see yourself functioning as a provider in a clinical practice setting, whether full-time or part-time? Alternatively, you might be drawn to participating in quality improvement initiatives within your practice. Understanding the distinctions and similarities between research, routine practice, and quality improvement is crucial. Research typically involves structured studies to generate new knowledge, while routine practice focuses on delivering patient care based on existing evidence. Quality improvement, on the other hand, aims to enhance healthcare processes and outcomes by systematically identifying and addressing areas for improvement. Each path offers unique opportunities and challenges, and your choice should align with your professional goals and interests. In this section, we explore the differences between observational study and clinical trials. Both involve human subjects and aim to enhance medical knowledge. Clinical trials are characterized by the prospective assignment of participants to interventional groups, including placebos or controls, to evaluate intervention effects. These assignments are strictly determined by the study's protocol. The goal is to discover or verify the effects of an investigational product, focusing on adverse reactions and efficacy. On the other hand, observational studies involve participants who are observed for specific health outcomes without randomization or research-assigned interventions. These studies may include diagnostic or therapeutic interventions, but the key is that they are not assigned by the researcher. Participants might answer questionnaires or surveys, and observational studies often include patient registries or retrospective chart reviews, utilizing historical data sets. Understanding these distinctions is crucial for integrating quality improvement initiatives into clinical practice effectively. Clinical trials are a cornerstone of advancing medical knowledge. They begin with protocol development, ensuring a structured approach to the study. Securing funding and budgeting are crucial steps, often involving collaboration with regulatory authorities and institutional review boards to ensure compliance and ethical standards. Subject recruitment and the consent process are vital, ensuring participants are informed and willing. During the study, patient monitoring is essential, focusing on adverse events, adverse event investigations, and serious adverse events. Follow-up with patients ensures long-term data collection and safety. Finally, publishing the study results contributes to the broader scientific community, enhancing evidence-based practice. Each phase is integral to the trial's success, ensuring that findings are reliable and applicable to patient care. Evidence-based practice is a critical approach in healthcare that ensures clinical decisions are informed by the best available evidence. It integrates high-quality research with clinical expertise and patient values. This means that when making decisions, healthcare professionals consider not only the latest research findings, but also their own clinical experience and the preferences and values of their patients. Evidence-based practice is essential for providing care that is both effective and personalized. By grounding decisions in robust evidence, clinicians can improve patient outcomes and ensure that care is both scientifically sound and aligned with what matters to patients. This approach fosters a collaborative environment where patient preferences are respected and integrated into the process. This slide discusses framing a clinical question using PICOT. P stands for population. In this specific example, that includes infants 4 to 12 months. I is the intervention of early peanut introduction. C is for comparison, comparing it with solids introduction education before 2017. And O is for outcome, the development of EPI guidance at well child checks. And T is for time frame. In this study, it was from September 25 to May 26. By focusing on these elements, we can enhance adherence to guidelines and ultimately reduce the incidence of peanut allergies in infants by using this framework for a study. This slide discusses the themes found in literature when reviewing this topic. The themes were screen high-risk infants is costly, caregiver and provider hesitancy around EPI screening, the risk of screening creep to other foods not included in the guidelines, generalized knowledge gaps, screening high-risk infants perceived as important to the prevention of peanut allergy, screening should be done in primary care settings, consistent classification of eczema severity in infants, and the window of opportunity to screen. So quality improvement is a systematic approach aimed at enhancing healthcare processes and outcomes. Unlike other types of research, which seeks to generate new knowledge, quality improvement focuses on applying existing knowledge to improve practices. It differs from evidence-based practice, which integrates clinical expertise with the best available evidence by emphasizing continuous process improvement. Routine clinical work involves day-to-day patient care, while quality improvement seeks to refine these processes for better efficiency and effectiveness. So there are some common QI frameworks, such as the model for improvement. This involves 3 key questions and uses the Plan, Do, Study, Act, the PDSA cycle to drive change. The Lean focuses on eliminating waste and streamlining processes to enhance efficiency. 6 Sigma aims to reduce variation through the define, measure, analyze, improve, and control methodology. Root cause analysis is crucial for identifying the underlying causes of failures, allowing for targeted interventions. Lastly, process mapping helps visualize workflows, making it easier to identify and address bottlenecks. Each of these frameworks offer unique tools and strategies to improve healthcare quality and patient outcomes. The model for improvement is a cornerstone in healthcare quality improvement due to its simplicity and effectiveness. It begins with an aim statement, clearly defining what we are trying to accomplish. This sets the direction for the entire improvement process. Next, we focus on measures, which help us determine if a change truly leads to improvement. Identifying change ideas is crucial. These are specific actions we can implement to drive improvement. The Plan, Do, Study, Act cycle is another model for improvement. It involves conducting small tests of change, learning from the outcomes, adapting the strategies, and scaling successful interventions. This iterative process allows for rapid and continuous improvement, making model for improvement a preferred framework in healthcare settings. By integrating these elements, model for improvement facilitates a structured yet flexible approach to enhancing patient care and operational efficiency. In quality improvement, we focus on 3 types of measures: outcome, process, and balancing. Outcome measures assess the impact of an intervention on patients or the health system. They help us understand the effectiveness of our changes. Process measures evaluate the reliability of the steps leading to the desired outcome, ensuring that each step is performed consistently. Balancing measures are crucial as they identify any unintended consequences of the changes we implement. By monitoring these, we ensure that improvements in one area do not negatively affect another. Together, these measures provide a comprehensive view of the intervention's impact, guiding us in refining our strategies for better patient care. In this project, our aim was to enhance the documentation of early peanut introduction guidance from providers to patient caregivers during 4, 6, and 9-month well-child checks, increasing from 13% to 40% from September 2025 and May 2026. This focused on several key measures to track improvement. The outcome measure was the caregiver-reported peanut consumption by infants by the percentage of 6, 9, and 12-month well-child checks where caregivers reported this consumption. For process measures, we looked at the percent of 4, 6, 9-month well-child checks with documented early peanut introduction guidance from providers and the distribution of home peanut introduction handouts, measured by the percentage of visits where the handout was included in the after-visit summary. Lastly, a balancing measure was considered. The average visit length in minutes for the well-child checks, ensuring that these improvements did not inadvertently increase patient time in the room. The lean methodology is centered on maximizing value for patients by eliminating waste. Anything that does not add value is considered waste. A key tool in lean is value stream mapping, which helps visualize every step in a process from start to finish. This visualization identifies types of waste, such as defects, waiting, unnecessary motion, and overprocessing. By recognizing these, we can streamline processes. Integrating these principles allows healthcare providers to enhance the quality of care and optimize resources. Electronic medical records, smart lists, are a practical application of the lean methodology in healthcare. By standardizing workflows, smart lists help streamline processes, reduce unnecessary steps, and minimize waste. This aligns with the lean principle of creating value by eliminating non-value adding activities. In practice, smart lists can enhance efficiency by ensuring that all necessary information is captured consistently, reducing errors and improving patient care. They facilitate a smoother flow of information. By implementing standardized workflows in the EMR smart list, healthcare providers can focus on their patient care instead of working to add in their own sets. Six Sigma is a powerful, data-driven approach designed to reduce variation in high-risk processes. It begins with the define phase, where the problem and stakeholders are clearly identified. Next, in the measure phase, baseline data is collected to understand the current state. The analyze phase follows, focusing on identifying root causes of the issues. Once these causes are understood, the improve phase involves implementing targeted solutions to address them. Finally, the control phase ensures that the improvements are sustained through ongoing monitoring. This structured methodology is particularly effective in environments where precision and consistency are very important, so helping with improving quality and safety in patient care. Root cause analysis is helpful for identifying the underlying causes of problems, allowing for the design of targeted and effective solutions. The purpose of root cause analysis is to move beyond superficial symptoms and uncover the true drivers of those issues. It's particularly useful in addressing safety events, workflow failures, and recurring defects. Common tools used in root cause analysis include the fishbone diagram, the 5 whys technique, and the Pareto chart. These tools help in systematically dissecting problems to reveal actionable causes. Understanding and applying the root cause analysis can help enhance the quality of patient care by looking at these solutions. Let's delve into the driver diagram. This is a strategic tool used to outline the pathway to achieving specific aims. In this project, the goal was to increase caregiver-reported peanut consumption during well-child checks at 6, 9, and 12 months. The driver diagram helps answer the critical question: what needs to change in the clinic or system to achieve this aim? It identified key drivers, which you can see here: education, documentation and reporting, work protocol, and access to peanut butter. Change ideas that were then looked at include creating an FAQ document for providers to address caregiver questions, sharing videos of using that EMR smart text. For documentation, hosting a kickoff meeting, adding language about readiness in the EMR, a work protocol using a process map with each clinic to outline the steps and address barriers, providing laminated copies of algorithms for providers, and to make sure they have access An idea could be secure funding to provide free peanut butter jars for patients who cannot access peanut butter on their own. So process mapping is a tool in quality improvement through the use of swim lane maps. These maps visually represent the workflow by delineating who is responsible for each task, when these tasks occur, and where potential handoffs might introduce risks. By identifying these elements, swim lane maps help teams understand the intricacies of their processes and pinpoint areas where improvements are needed. This method is supported by the research, and it emphasizes the improvement of visualizing workflows that enhance efficacy and safety. Quality improvement frameworks can help complement some of the other frameworks and can work together with, they're not competing, they're complementary. So they can work together, Lean and MFI. We can look at identifying waste and testing solutions. Six Sigma allows for diagnosing variation, and MFI drives rapid cycle testing. So understanding how these frameworks fit together allows for a more comprehensive approach to problem solving and quality enhancement. Quality improvement is a systematic approach to enhancing healthcare processes and outcomes. Quality improvement aims to refine these processes for better efficiency. So the plan, do, study, act tests changes in real time, and the model for improvement sets clear aims and measures. It's important when implementing a project to view it as a gradual rollout rather than a single event. So frequent reassessments and the plan, do, study, act cycles are essential to refine the processes. So you can see that there's different dates, that different components of the PDSA cycle were implemented, and then changes that were then made to improve those outcomes. So project implementation is not a single point in time, and it continues to have these frequent reassessments, and it's important to get feedback from all parties who are impacted by the project. So how do we present QI data? You want to start by clearly defining the objectives of the data presentation. You can use visual aids like charts and graphs to make complex data more accessible and understandable. You can tailor the presentation to your audience, focusing on the aspects of data that are most relevant to them. You can highlight patterns, trends, and any significant changes over time. You want to make sure that the data is accurate, up to date, and presented in a logical sequence. Encourage questions and discussions to clarify any uncertainties and to foster a collaborative environment. By presenting this data, we're able to facilitate informed decision-making and promote continuous improvement in practice. So let's look at the anatomy of a run chart. A run chart is a straightforward tool that helps us visualize data over time. By plotting data in chronological order, we can easily interpret trends and patterns. The analysis focuses on how data points distribute around the median, offering insights into process performance. Creating a run chart is fairly simple, whether using it on paper or Excel. However, it's important to note that run charts are less sensitive and might miss some special cause signals. Additionally, they lack predictive capabilities, meaning they show past performance but don't predict future outcomes. Despite these limitations, run charts remain a valuable tool for initial data analysis and quality improvement efforts. Let's look at a concept of a shift within the Plan, Do, Study, Act framework, specifically in the context of provider education. A shift occurs when there are 6 or more consecutive data points, either all above or all below the median. This pattern indicates that the change implemented is likely not due to random variation. Instead, it suggests a significant impact from the intervention. Recognizing shifts is critical in quality improvement as it helps validate the effectiveness of changes made. By identifying these patterns, healthcare providers can confidently attribute improvements to specific educational strategies. And it allows for more informed decision making. In this segment, we focus on the Plan, Do, Study, Act cycle applied to peanut butter delivery. This framework in quality improvement allowed to test changes on a small scale before full implementation. For peanut butter delivery, the plan phase involved identifying the delivery process and potential areas for improvement. During the do phase, the proposed changes such as optimizing delivery routes or packaging methods were discussed. In the study phase, data was analyzed to assess the impact of these changes on delivery efficiency. Finally, the act phase involves deciding whether to adopt or abandon the changes based on the results. This iterative process ensures continuous improvement and can be integrated into clinical work. So we can see on this phase that there is a trend, and the trend is identified when there are 5 or more consecutive data points moving in the same direction, whether increasing or decreasing. The key focus is on the direction of these data points rather than their position relative to the median. This concept helps in recognizing patterns that may indicate areas needing improvement or successful interventions. This here is an example of how the SMART sets were put into practice within the electronic medical record system. A run refers to a sequence of 1 or more consecutive data points on the same side of the median. Each time the data crosses the median, a new run begins. Identifying too few or too many runs can indicate non-random patterns, which may suggest underlying issues or improvements in the process. This concept is helpful for analyzing process stability and identifying areas for improvement. Here is an example of a handout that was given as part of the PDSA cycle. This is some more data from the REN chart. The center line is based on baseline performance and was intentionally held constant. There were no center line shifts or recalculations applied. The anatomy of a control chart is discussed on this slide. Unlike other charts, this tool is more complex and requires special templates or software. Its sensitivity and power lie in its ability to use control limits, which add rigor to the analysis. These control limits, set at plus or minus 3 standard deviations, help in accurately predicting future performance. The center line represents the mean, providing a baseline for comparison. This chart is helpful in quality improvement and offers a precise method to monitor and enhance processes, ensuring that any variations are within acceptable limits. So let's explore changes your clinic might need to enhance patient care and efficiency. First, consider increasing the percentage of families who correctly use autoinjectors. This involves targeted education and practice sessions. Next, we could think about reducing unnecessary IgE testing for foods without clinical indication. We could address the issue of patients arriving for skin allergy testing without stopping their antihistamines. Perhaps clear pre-test instructions could help with this. Additionally, increasing the percentage of children attending school with a food allergy action plan could be helpful. It would ensure safety and preparedness. And finally, what changes could reduce wait times for oral food challenges? Each of these areas could be potential opportunities for quality improvement and align with the frameworks that were discussed. So sustainability is crucial for long-term success of any quality improvement project. A project should be able to thrive without constant oversight or babysitting. To achieve this, it's essential to have partners who are committed to the outcome goals. Their dedication ensures that the project remains aligned with its objectives. Regular reassessment and data collection are also vital to gauge sustainability. This process helps identify areas needing adjustment and ensures the project remains on track. Additionally, gathering feedback from all parties impacted by the project is critical. This feedback provides insights into the project's effectiveness and areas for improvement, fostering a culture of continuous enhancement. By integrating these elements, we can ensure that quality improvement initiatives are not only successful, but also enduring. Thank you for attending the Quality Improvement Basics